Calvin and I met about 6.5 years ago. Very active. We're extremely outgoing. We shoot pool. We go bowling. We ride motorcycles. We are all the time outdoors. And when he found out with the colon cancer, that put everything on a halt. He had no symptoms whatsoever. He was 62 at the time, had never had a colonoscopy, any kind of testings or anything like that done. And I did encourage him as routine guidelines to go and have that done. There was a history of cancer in the family, but other than that, no symptoms whatsoever. He had a colonoscopy done. At the time of the colonoscopy, they found a large mass in his colon. They were pretty sure at the time that it was cancer, but they still sent it off for biopsy. After that, he had to have a colon resection. 14 inches of his colon was removed. He has still ongoing issues. After his colon resection, he had to have another procedure and had a port put in. 6 months of chemotherapy every 2 weeks for about 4 hours a day. Made him extremely sick, extremely nauseated, a huge weight loss. Then he developed blood clots, and it's just an ongoing thing. Still swelling. He still has one blood clot still yet. Depression, angry. He was very upset with the chemo, the way that it drags you down, and your mental side it completely takes over. It really does. You don't want to go anywhere. You don't want to do anything, and you're afraid to go out because it compromises your immune system as well. So you're afraid to get sick, and you don't want to eat. You lose your taste, and you lose feeling in your feet and in your hands. He could not reach into the refrigerator to get a drink or in the freezer without having gloves on, because it does so much to your body. It completely drags you down, and it's as hard on the family as it is almost on the patient as well. Seeing them go through the weight loss and the nausea and the being so sick and going to all the doctor's appointments. So mentally, if you would just explain to yourself, it's something that needs to be done. It's like any other testing. You're going to the doctor to get a blood pressure medication refilled. And that's really the mindset that you need to get into, is that I'm doing this to better myself, for myself, for anyone out there, for family members, so that you yourself and them don't have to go through this. Because if it's caught in time, you don't have to go through all that. You don't have all the doctor's appointments and the chemo and everything. It's something that desperately needs to be done. I highly recommend everybody does it. Now, almost 2 years later, we are slowly but surely getting back to him feeling like he wants to do things. It's not the way that it was before. Hopefully it will be that way again. But he does try very, very hard. He works very hard, and he's super outgoing, and he loves to do stuff. But the fatigue it still can get to him at times, and he just don't feel like doing it. And then the long-term effect of the chemo was on his feet. He still can't feel his feet. It's almost like a diabetic neuropathy. And so he's real leery about falling. He's real leery about, and he trips and his balance is off a little bit. And it's only because he can't feel, and they said it may go away, but it may not. So if this is caught early enough, you can avoid a lot of that, a whole lot of it. Out of all 3 of the colorectal screenings that we have available, the most important one is any of them that gets done. We have the fecal occult blood that you can do in your home. It's a home kit. We also have the Cologuard that can be done by mail, and you send that in to them. And then, of course, we also have the colonoscopy as well. My recommendation, and that's just me with what I have been through, is I think that everyone should do a colonoscopy, a full colonoscopy at least once. Couldn't recommend it highly enough. I really couldn't. Because I mean, if we hadn't found his, he probably wouldn't be here right now. As soon as you can get of age, have it done. Have it done.